Very much, Kayla. Thank you, Premier. Kayla, is the slides visible?
Yes, Dr. Cloete.
Thank you very much. I'm going to give an update today on the surveillance and the response, then also our health platform response, and then our healthcare workers, and then to talk about phase 1 of the vaccine implementation, and then phase 2, the plans that are underway for phase 2. So on the surveillance and the response, the Premier has mentioned this, that we have a continued exit of a second wave. All the markers that we normally track shows a steady decline, and it continues to show a steady decline. You can see the green is for the oxygen use, the blue is the hospitalization, and we're very glad to see the hospitalization dropping further. And then the bars are the cases, and then the red lines are the deaths, and a continued drop over this period. If we look at the deaths specifically, you will see that our deaths continue to decline. We, in the last 7-8 days, were in single digits on our daily reports of deaths, which is good news. So we're going to a very stable, low base between waves in the Western Cape. The R number, the reproduction number, as the Premier has mentioned, we're glad to see that it was above 1 last week. It's come down below 1. And that is what the intention is of identifying small areas of potential outbreaks and containing it. So we want to keep the reproduction number under 1. That means we will not see the start of an increase of cases. If you look at the provincial overview, you can see that the new COVID cases have essentially plateaued out. We are still diagnosing about 130 to 140 new cases each day of last week. Admissions and the death continue to decrease slowly, with a 3% and an 8% decrease on admissions and deaths. If you take the 7-day average on the 2nd of April, we had 30 new admissions and 3 deaths for each day. The proportion positive has increased slightly to 6.1 on the 2nd of April. It is due to the reduction, or we test fewer people on a public holiday, rather than an increase in actual cases. The Metro specifically, where we had a concern last week, essentially is largely unchanged over this last week. The percentages varies, but the absolute numbers are relatively small. With the public holidays affecting the testing patterns, it also, the week-on-week comparison is a little bit difficult, because if you take a 5-day week versus a 3 or 4-day week, it's interpretation. But even with that, we make sure that we interpret what's happening. In the rural, the cases are slightly increased this week. There's a 4% increase. There's wide variation across the areas. Cape Winelands continue to be a concern for us, because we continue to see an increase in cases amongst young people under the age of 30. And clusters at the University of Stellenbosch are being monitored and are mostly now under control, but there's been a few clusters in the town of Stellenbosch related to students in the town. If you look at our surveillance huddle report, this is what we normally update for all of you. But this is, you can see across Khayelitsha Eastern, Klipfontein, Mitchells Plain, Northern Tygerberg, and even Southern Western, there is generally good control. Quite interestingly, in the Southern Western, it's also where most of the port cases come in. So when people come in on ships or leave on ships, there's normally cases that's been detected, and a lot of asymptomatic cases been picked up. Example that they use is a Spanish tour group where 8 asymptomatic cases tested positive prior to a flight back. So it was this issue about increased testing prior to travel, and that's where some of these cases has come from. Cape Winelands, and that's the area where we say associated with Stellenbosch and the students. There were specific residences, and the majority of cases are under the age of 30 in the Stellenbosch area. The rest of the areas is relatively quiet. Central Karoo quiet, Garden Route. There was an increase in Mossel Bay and Hessequa, but it's small numbers. George, there was an increase, but it's small numbers. And generally all over in Overberg and West Coast, it is relatively under control. But this is just a sign that all our teams are in heightened vigilance, watching for every possible sign of any cluster to respond quickly and to contain. And that's the containment mode we find ourselves in. Triangulating the wastewater, just to make this very clear that this is very much a Medical Research Council initiative in collaboration with municipalities. And we're eternally grateful for the Medical Research Council for this very innovative system. So in tracking the wastewater, we can see in the metro 15 treatment plants, including Belleville, which had a spike the previous week. There's no COVID detected in there. There's been a high reading in Zandvliet, which drained Khayelitsha and Blue Downs, and the teams obviously also use this information to go and see what is their awareness in those areas. Breda Valley, there's been a decrease at Toes River, and there's been noticeable increases at the Dorings and Worcester. Theewaterskloof, there's been no sampling in this past week, so we cannot report on that. So we continue to make recommendations for the extended holiday period that we're in, and it's really just about avoiding or being vigilant against interprovincial travel, avoiding gatherings, and if we must gather, to keep it small, keep it short, keep it outside, and to keep it quiet and not sing. And social distance, ventilate, mask up, and hand hygiene is like the fundamental habits that we would like by now to be the norm for all of us as we navigate the reality of COVID still being around us. And that is keep it small, keep it outdoors, keep open windows, especially on public transport as well, and skip the crowds if at all possible. The health platform response today, we can say we edging down to about the 700 mark. There's only 756 COVID patients in our acute hospitals across public and private. They are declining steadily. The occupancy rates overall across the hospitals is in the metro above 87% in the George, Paul and Worcester area. But if you come to the occupancies for COVID beds, it is in the teens. And that is with the reduction of COVID beds, it is in the teens. Overall, only 5% of all patients in acute hospital beds currently has COVID or are under investigation for COVID. And Hospital of Hope in Brackengate only has 10 patients, while Mitchells Plain Hospital of Hope and Swanstraal has no patients. And we have started using that space for other patients, being ready to scale up if required for a third wave. The Mass Fatality Center has currently only one body and one decedent, and the bodies generally has been managed extremely well across the platform. If you then look at this as a summary, you can see that of all the acute hospital beds, 80% are occupied, 12% of COVID beds, and 5% of all patients in our hospitals are COVID or people under investigation. And then oxygen is something that a marker that we really monitored. We're now down to 24 tons combined between private and public sector per day. And that's against above 80% we had at the peak. 80 tons that we had at the peak. The public sector utilization is 15 tons per day. And that's compared to 51 tons we used in the first week in January. So we are stabilizing our platform and preparing from the lessons we learned from the second wave to be able to cope with oxygen demand as the third wave nears us. Very interesting data for this week is we looked at our Sentinel surveillance trauma report. And this is 13 emergency centers now. We used to do it at 4 or 5. Now we're doing it at 13 hospitals. And the picture for this over Easter. So Easter usually see increased trauma presentations. But you can see the arrow to the right. You can see that this year on Easter we show a blunting of the numbers of admissions. So if you compare that Easter peak, it is significantly lower than the 2 weekends before we had. So relative to the 4 weekends before, it is the second lowest number for peak trauma. It's only in the middle of March where it was slightly lower. And the 7-day average, moving average over Easter saw similar numbers to the previous month. So during the month of March, we more or less were at the same kind of numbers. So this gives us a sign that there has been it was less than what we would have normally expected for Easter in terms of trauma cases at these 13 hospitals. We also then looked at, when we overviewed this in terms of the dates, the Easter weekend or the weekend prior to Easter, comparing that weekend to Easter, where there was these no alcohol, there was limited to no alcohol restrictions to Easter weekend. There was no alcohol restrictions the week before, but in Easter there was limited alcohol restrictions. There was a 19% decrease in road traffic accident patient presentations. And it shows the impact of the fact that there is a combination of alcohol availability, but also heightened policing and traffic policing over the Easter weekend has had an impact, and that we had a relatively quieter Easter weekend than the preceding weekend in comparison. So when we look at the healthcare workers, I'm very glad to show you this slide today. This is a figure that we have not seen for a long time. Although 8,800 cumulative infections have happened in all our healthcare workers in the Western Cape Government Health, currently we only have 16 active cases. And if you look at this infections per month, you will see that in the month of February, we had 125. That was the third lowest month since April last year. In March, that just completed, we only had 38 infections in healthcare workers. That is the lowest month over the last 12 months. And so far in April, we've only seen 2 infections. So this holds very good potential for us. And we'd like to believe it's the early impact of the vaccination amongst healthcare workers. So those 16 active cases is 3 in doctors, 4 nurses, 7 in other categories of staff, and 1 radiographer and 1 pharmacist. But the interesting part of this graph is really to see it's really to see that in the last couple of weeks, you see the 1, the 2, the 3, the 1, the 3, the 1. That is the number of infections that has been amongst healthcare workers now sustained for something like 5 weeks. And we're watching that because as the vaccinations increase, that will be important for us to continue to watch this trend amongst healthcare workers. In terms of additional staff, up to date, we have now added in 834 filled posts across the platform. And we are now very clear that we are maintaining these posts all the way through for vaccination and for phase 3 and for the third wave. If I come to the vaccine update, it is now anticipated that we will probably be able to cover more than 60% of healthcare workers with the limited doses received via the SONKI program. And we are very much preparing to scale up vaccination during April to complete phase 1 vaccination for healthcare workers with the expected arrival of the Pfizer doses by mid-April. And this is just a SONKI update. You can then see since the launch, we have had 54,000 doses of the initial 300 doses. And then we expect, and that is on its way to us now, by about the 10th or the 11th, that is the coming weekend, we will be expecting another 36,000 doses out of the next and final tranche of 200,000 doses of Johnson & Johnson that is now being dispensed. So to date, we've received 54,000, and by this weekend, we expect an additional 36,000 doses to arrive. So a total of 90,308 doses will have been received by Sisonke. And that now will be able to cover almost 68% of our healthcare workers in this province. That is, that's significantly more than we initially bargained for, and that is 2/3 of the healthcare workers will be vaccinated by that. And then you can see if the Pfizer vaccine comes in, the balance is the other third. So as of 7th of April, we have now a total of 52,000 people out of the 54,000 doses that's already been vaccinated. So we're waiting for this additional 36,000 to come in over this weekend. When we look at the vaccine sites, it is Malamed for the private sector, Khayelitsha, Grootskei, Tygerberg, and Mitchells Plain. And in the rural areas, Caledon, Worcester, George, and Paarl for both private and public. And the vaccine implementation, we've learned a lot about the electronic vaccine data system, and the process is much more streamlined, and we know how to now use it effectively in preparation for phase 2. And this is a graph to show that we've gone to 52,202 yesterday. And you'll see the split between Grootskeur 13,400, Tygerberg 10,200, Gatesville 9,200, and then the other additional sites with George at 4,300, Worcester 2,300, Paarl 3,100, and even in a place like Caledon, it's now 1,300, plus the additional sites in the metro. We currently have 2,400 vaccinators trained, and that is now the vaccinators that we will have to deploy in preparation for phase 2. So phase 2 preparation, and it will start in May. And I know a lot of questions is about the detail of this. So I will give you where we are currently. We've learned from international lessons, the best practices, that there are 3 key things. You need to be able to schedule appointments, monitor and report. You need to have buy-in of people, and you need to have a highly organized, efficient logistics. The last one being the key to having a successful vaccination program. We've learned from the Sisonke vaccine a lot of things that has put us in good stead to now scale up to phase 2. So this is a steering committee that I do chair, and we have 3 streams, one on social mobilization, one on operations and logistics, which is the biggest part of the work, and then on information systems. We met 2 days ago. We're putting the last planning systems in place so that we can have a successful and scaled up process to kick into being when phase 2 kicks off in May. This is the supply line from National. Our intention is over the next week to create a supply line specific for the Western Cape with very clear indication of when we can expect Pfizer and Johnson & Johnson vaccines, and then to plan our deployment accordingly in the Western Cape. This is just the update from SAPRA, and SAPRA has given us this update so we know exactly where we are. Currently, Johnson & Johnson and Pfizer has got SAPRA approval for use in this country, and Sputnik and Sinovac, those 2 are under consideration by SAPRA, but has not been approved for use in South Africa yet. So if anybody wants to know about the supply line of vaccines in South Africa, these are where we are currently. And the process we followed in this province, we are currently finalizing our final report on the 28 entities that have provided specific details with follow-up meetings with them. And each submission has been evaluated with due diligence. We will be articulating that report to the Premier tomorrow, and we know exactly where we are. We've approached Johnson & Johnson as Pfizer, as you can see from the supply line. They're currently working very hard to conclude their agreements with the National Department, and which we will be getting our supplies from. Our next steps is we are looking at a request for information targeted process with a view that we potentially would start acquiring additional vaccines to supplement the national supply of Johnson and Pfizer by about August. We have specific follow-up with foreign government to be explored by the Department of the Premier, and we are engaging the private sector. We're also looking at liability and no-fault provisions because those are going to be the key considerations when we do go into direct procurement of vaccines. This is the picture. We are planning for 36,000 vaccinations per day. That's currently where we're looking at. And it will be a combination of small, medium, and large sites. We have done our modeling, sent it to teams, and they have used this calculator, and the teams are now confirming a combination of these sites, small, medium, and large sites, across each of the areas, in each geographic area in the Western Cape, in preparation for phase 2. So this is more or less what it's going to look like. We know exactly how many vaccinators we have, what supplies we require, and each local team in this province are currently putting this together. So there is a decentralized process in each of the districts outside the metro, where the teams are putting this together from Central Karoo, Garden Route, Overberg, West Coast, Cape Winelands. Every team is putting this in place. And in the metro, we're putting it in place geographically across the areas of the metro. And just to make this point, the big allocations that will be coming our way from Pfizer and Johnson & Johnson, the first band of people for phase 2 that will be immunized is people over the age of 60. So we will be working very hard and clear to make it very clear to the over 60-year-olds in this province. That phase 2 starts with the people over the age of 60. We will, down the line, start saying other bands will come in. But for now, the first priority is to start with the vaccination of people over the age of 60. And we are putting systems in place to make sure that we can reach all the 60-year-olds and get off and make sure that we reach our target to start off phase 2. So in conclusion, our current situation is that we've navigated quite successfully an exit from the second wave, clear and consistent decline of hospitalization cases and deaths. We have moved into this heightened vigilance phase, and we continue to urge everyone to adopt the habits to protect themselves and others. We saw it could be done over Easter weekend. We wanted to continue for the next at least 4 to 8 weeks so that we can delay the third wave. We have reflected on our experience, so we've got detailed plans for the third wave when and if it arrives. But we need this whole of government and whole of society response to mitigate this third wave while we significantly scale up and implement vaccines over the coming months as the key drive. Thank you very much.
Thank you very much, Dr. Cloete. So we'll now move on to the question and answers portion of the DigiCon. Please can you indicate your questions by raising your hand or using the WhatsApp group. Please also note who the question is directed for, your name and your media house. I'll now read out the first question received from Namli from the SABC, which is directed at Dr. Cloete. The question is, what impact did trauma cases have on the processes? What are the plans to avert the third wave successfully? And then if Premier could also just come in to add any comments on that. Thank you.
Sorry, Kayla, is the Premier going first or me?
Sorry, Dr. Cloete, if you could please go first and then Premier could come in afterwards.
Okay, thank you very much. So thank you for that question. What we presented with you on the picture there is that a combination of the alcohol restrictions that were introduced for the Easter weekend. That is the restrictions on off-site sales of alcohol, and law enforcement and vigilance on the roads has worked together, and obviously with more responsible behavior, has worked together that there were fewer trauma cases over this Easter weekend than we normally would have expected. And that is measured at 13 emergency centers across the Western Cape. Therefore, the impact of the trauma cases over the Easter weekend on the beds utilization was less than it would have been in the absence of what we think the alcohol restrictions and also the heightened traffic policing that happened over the weekend. So that's the impact of the trauma cases. In terms of the third wave, we have made it very clear that there are certain factors that will impact on the third wave. We have put in place a range of planning parameters for that. But the most crucial thing at this point in time is delaying the third wave. Therefore, picking up any early signs of clusters and being heightened vigilant to make sure that we contain them is the most important step for the next 2 months for the delay of the third wave. We're not sure exactly when the third wave will be, how high it will be, but the modeling group that has worked with the South African Medical Modeling Group Consortium are putting scenarios together. Our infectious diseases specialists are working with that group at the National Ministerial Advisory Committee, and they will be releasing these models for predicted heights of third waves. And those predictions that they do is a combination of whether there's any new variants, whether there has been protection because of the antibodies people have from the previous infections, whether the movement and the behaviors will be relaxed or can be maintained, and the change of season. If you put all of that together, plus the last factor, how many people potentially could be vaccinated, those will all influence how high and when the third wave will be. But what we've done in this province is we've got a team that are planning for the response to cases, but at the same time planning for a health platform response if the cases starts increasing. And that's bringing online additional beds, additional staff, additional oxygen points to be able to cope with the hospitalization need when we enter a third wave. Thank you very much, Kayla.
Thank you, Dr. Cloete. Premier, are there any additional comments that you'd like to make?
Thanks, Kayla. I think Dr. Cloete's answered them.
Thank you very much. So we've received a few queries from Arthur from Heart FM. The first question is to Dr. Cloete. What are the number of cases are quite low over the past weeks. I'm wondering how well this matches the models you have, and if the cases are lower than expected, what do you think is the reason for this?
Thank you very much, Kayla. Thanks, Arthur. Very insightful question. Let me put it to you this way. The number of cases over the past few weeks have been lower, and it is relatively low, and it's remained low. As I've tried to explain, the models are still being developed by the modeling group. And therefore, when the models do come out, we will see how it matches what the expectation is versus what is happening in real terms.
Well, relatively quieter Easter weekend than the province has seen in previous years, and people above 60 will be the next in line for vaccination. That's from Western Cape Premier Alan Winde, together with Western Cape Head of Health, Dr. Keith Cloete. Will keep unpacking the points of that conversation as we continue with the show. Let's start the hour.